Wash hands and put on clean gloves. Set up your bedside table and gather the following supplies: appropriate size catheter, sterile lubricant, antibacterial wipe, a graduated cylinder or other container for urine. If your child requires a flush, also include a 60 ml 2-me syringe or catheter tip syringe, and sterile normal saline or medication is ordered. Sterile saline is safe to use for 48 hours after opening. The gauge of the catheter is measured in units of French. Your healthcare provider will tell you what French size is appropriate for your child. Wash the area around the urinary opening to prevent infection. For boys, cleanse the area around the top of the penis. For girls, clean each side of the labia from front to back, then clean down the middle, front to back. Lubricate the first several inches of the catheter tip. Insert the catheter into the urinary opening. For insertion of the catheter on a boy, hold the penis and advance catheter approximately 6 to 8 inches, and for girls, advance catheter approximately 1 to 2 inches. When the catheter is properly inserted, you will see urine will flow into the catheter's bag or container. If no bladder irrigation is ordered by your provider or physician, you may slowly and gently remove the catheter once urine has stopped flowing. Kink off the tube of the catheter and pull straight out. Measure and record the amount of urine in the collection device if instructed by your healthcare provider, then empty. Note the amount, color, and clarity of the urine, presence of mucus, clots, or sediment. Note any sign of discomfort and how the catheterization was tolerated. If you need to irrigate the bladder, then leave the catheter in once the bladder has been completely drained. Draw up your child's ordered amount of sterile normal saline irrigation into your syringe. Bladder irrigation is used to help rid or rinse the bladder of unwanted bacteria, sediment, and debris. Introduce solution at a steady rate through the catheter into the bladder. When you feel no resistance while pulling back, draw back 15 to 20 ml of normal saline. Now gently use the push-pull method to avoid trauma to bladder wall, pushing in to the 5 ml mark and back out to the 15-20 ml mark. Allow gravity to assist you. By lowering the syringe while you use the push-pull method, sediment will settle on top of the plunger. Perform the push-pull method 10 to 15 times until return is clear. If resistance or pain is met when withdrawing fluid from the bladder, suction may adhere the catheter tip to the bladder wall. To release the suction, gently instill a small amount of fluid through the catheter and reposition the catheter. Resume irrigation. If the urine remains cloudy, repeat the flush. First, in a steady motion, withdraw the full amount of sterile normal saline inserted, dispose of the used sterile saline. Keep in mind to subtract this fluid from the output total. And using the same syringe, draw up additional ordered dose and repeat the previous steps. If your child's orders include to leave in an indwelling medication such as gentamicin, once the bladder is empty of the sterile saline, a new syringe of medication will be attached to the end of the catheter. You will push in the total volume of the medication into the bladder and it will remain inside until the child urinates or is cathed again. Once the full amount of sterile normal saline has been removed, you can kink the tube and then slowly and gently remove the catheter. Clean the cylinder with full-strength hydrogen peroxide and keep at bedside. Change out cylinder monthly and as needed. Then finish by washing your hands again. Monitor the child for signs of infection such as fever, cloudy urine, painful urination, foul-smelling urine, or other abnormal symptoms such as blood in the urine. Notify your provider if these signs are present. Monitor the skin for signs of inflammation or infection, including redness, swelling, discharge, and tenderness. Notify the practitioner if signs of inflammation or infection are present.